Excellencies, distinguished guests, champions of vision, viewers and listeners online. Welcome to the Value of Vision, the case for investing in eye health. I am your moderator for the next 75 minutes or so. My name is Femi OK. What are we going to be doing in this conference room? Well, we'll be looking at the transformational impact of investing in eye health, the policy frameworks needed for that investment to be successful, and then also hearing some new research. We have so much to do in a very compact amount of time that I know that our practitioners and our politicians will be brief, but beautifully on point. If you're not sure how long brief is, it's about 2 minutes, which is about the length of time it will take me to introduce this next video, which starts us off. It scene sets. It gives us the sense of what we are doing here today and why. Let's take a look at the video screen.
The work to achieve eye care for all has come a long way.
On behalf of Antigua and Barbuda, Ireland, and my own delegation Bangladesh, and 101 co-sponsors as of last count, I have the honor to introduce the first ever UN resolution on vision.
But there is much work still to be done.
This provides us with a unique opportunity to cement eye care in the broader global health agenda.
The task of tackling eye health is even more imperative now than ever before, and the need to work together all the more vital, because if we lose momentum now, we could face an almost impossible challenge.
The loss of eyesight is a tragedy. But when it happens, despite being preventable, it's an outrage.
Sometimes solutions to our problems in the world are epic and epically expensive. But here's something where a few pounds, where a few dollars can and will change a life. We should crack this issue of vision now.
Eye health is universal. At some point, we will all be affected by an eye health issue. Yet too often, it is overlooked or deprioritized. The consequences are far-reaching: higher rates of unemployment, years of schooling lost, social isolation, and increased risk of injury and illness. And the problem is set to worsen. But if we act now to reach the 1 billion people living with avoidable vision loss, in just 5 years, we can change hundreds of millions of lives for the better. In low and middle income countries, every dollar invested in eye health will yield a $28 return. The impact by 2030, 22 million people gaining employment, 13 million school years gained, and the boost to the world economy would be $447 billion annually. The benefits will be felt in every community and country, and every family and generation to come. The good news, we have the solutions. 6 accelerators that will supercharge the fight against avoidable vision loss. Expand community screenings, provide reading glasses on the spot, grow the eye health workforce, boost surgical productivity, remove barriers to access, and improve cataract surgery globally. To achieve that, we need commitments from the highest level of government to invest resources, drive innovation, foster partnerships, and roll out solutions at pace. Join us, and we will end avoidable vision loss.
Excellencies, I'm going to ask you to speak from your seats. This is a seated discussion and a seated event, with one exception. Now, what makes His Excellency Wharton Webson so special? Well, he's the permanent representative of Antigua and Barbuda to the UN, and he will be doing the welcome remarks for our excellencies to start our event.
Thank you very much, Phoebe, and welcome, and good evening, good morning. We know we have people online, so we are being seen all over the world. Excellencies, Honorable Prime Minister, Ministers of Health, Ministers of other government ministries, ladies and gentlemen, friends. Thank you for being here, and this is indeed another landmark moment. Vision for us and the discussions we have been having over the past several years is not just a health issue. It is about human potential, equity and progress. If we are serious about achieving the Sustainable Development Goals, then, colleagues, we must recognize that the ability to see is fundamental to every one of us and achieving each one of those goals. Today, colleagues, we are reminded that progress is not only possible in this area. When we act together, it is probable. Eye health is no different. It is an issue that transcends borders, and its solution demands cooperation. The theme for the 80th Assembly this year is Better Together. This speaks directly to our work here as the Friends of Vision. No single country can end avoidable blindness alone, but through partnership, innovation, and solidarity, we can ensure that sight and opportunities is created for all. The Friends of Vision group exists because we know we are stronger together. From just a handful of member states whose idea formed this group, we have now a coalition of almost a third of the United Nations body. By the conviction, we are all under the same conviction that vision is central to the SDGs and to the future we all want. Together with my esteemed co-chairs from Bangladesh and Ireland, who are here, we unite together with our friends in the United Nations. And I thank them for their dedication to this very important issue. As we mark the 80th years of this United Nations, we are reminded that lasting progress requires leadership at the very highest level. That is why, my friends, that is why, Excellencies, that it is fitting for us to bring together today the leaders of so many nations. And we are delighted that so many of you, prime ministers, presidents, and leaders, ministers of many countries in this room, are here to be able to work with us and to help us to turn the resolution just referred to, turn that resolution from paper to people so that we can respond. It is my honor and great privilege to introduce a dear friend, not just the Prime Minister, but a dear friend from Antigua and Barbuda, the Honorable Prime Minister of Antigua and Barbuda, Honorable Gaston Browne, to say a few words to us. Prime Minister.
Thank you very much, distinguished Ambassador. You know, and I want to thank you very much for your introductory remarks. Our distinguished ambassador has defied the odds of vision loss. Clearly, he's the exception, and we all have to continue to promote the value of vision. Distinguished colleagues include my colleague Prime Minister, the Prime Minister of St. Kitts Nevis. 5 years ago, this Assembly made history. We adopted the landmark resolution, Vision for Everyone, a resolution co-sponsored by Bangladesh, Ireland, and Antigua and Barbuda, and embraced unanimously over 100 nations. That resolution was not just on paper. It was a promise to more than 1 billion people around the world living with preventable or treatable vision loss. A promise that they would no longer be denied the right to see clearly, to learn fully, to work productively, and to live with dignity. But 5 years on, the reality is sobering. Progress has been far too slow. Millions of children still sit in classrooms unable to see the blackboard or whiteboard. Workers are still leaving their jobs because their vision no longer allows them to perform safely or effectively. Our elderly, who should be pillars of support in their families, are too often sidelined because of impaired sight. This is not only a human tragedy, it is an economic one. It is the waste of billions of lives worth of untapped potential. Colleagues, the case for action is not only moral, it is also economic, and it is certainly overwhelming. A new investment study released today by the IAPB, the Seaver Foundation, and the Fred Hollows Foundation makes this plain. If we were to provide vision care to that 1 billion people, the world will gain the following: $447 billion in economic returns every year, 22 million new jobs, 13 million additional school years for children, and 320,000 more years of life lived. And we would reduce road accidents, depression, and the crushing burden of unpaid care borne by hundreds of millions of families. These are not abstract figures. They are opportunities for growth, for development, and for dignity. For small states like Antigua and Barbuda, the logic is crystal clear. Investing in eye health is not charity. It is smart economics. It is a direct path to productivity, prosperity, and resilience. And so, colleagues, just as 2021 marked a watershed moment, today we chart the next. I'm proud to announce that Antigua and Barbuda will host the first ever Global Summit on Eye Health in 2026. This summit will not be another talk shop. It will be a platform for leaders, international partners, the private sector, and civil society to commit to tangible, measurable action. We will focus on innovation, on partnerships, and on strategies that deliver results, restoring sight, restoring potential, and restoring hope. Colleagues, the choice before us is stark. Either we allow vision loss to continue robbing the world of talent, productivity, and human dignity, or we act decisively and reap the social and economic dividends that are right in front of us. The time for talking is past. Now is the time for action. I thank you.
Prime Minister Browne, would you put your microphone on for 30 seconds, one more time? Because I feel you stunned the room with your announcement, and there was a bit of a pause between the reaction. So can you just do that announcement one more time? Because now that we've got over our shock, I know the reaction will be slightly different. Prime Minister.
Thank you very much. So I am pleased to announce that Antigua and Barbuda will host the first ever Global Summit on Eye Care in 2026. Thank you.
Thank you for coming to rehearsal. Thank you, Prime Minister Browne. The Honourable Health Advisor for Bangladesh, Her Excellency Ms. Nurjan Begum, thank you for joining us. The floor is yours.
Thank you. Honorable Chair, Excellencies, distinguished delegates, Bangladesh is honored to join this discussion on the value of vision. Eye health as a foundation of development, productivity, inclusive growth. For us, eye health is not a vertical program, but a smart, system-wide investment in human and social capital. When people can see, children can learn, adults work safely, older persons remain independent, and households avoid catastrophic cost. We have about 1,500 ophthalmologists nationally, most in the city, private sector. Our current cataract surgical rate approximately 2,500 per million per year against an ambition to reach 5,000 per million by 2030. Our approach is to put eye care where people already seek care, people-centered primary health care. We have established community eye center inside Upazila Health Complex and staffed by trained ophthalmic personnel and digitally linked to ophthalmologist as based hospital, each covering roughly 200 to 300,000 people, typically is 15 to 80 kilometers from its base hospital. This model is scaling. With government and NGO partners, we have built approximately 330 primary eye care centers and plan to add 250 more centers, upgrade 30 district eye units and 17 additional base hospitals. The aim is simple: earlier detection, reliable referral, higher surgical number, good visual outcome. The investment case is convincing. Cataract surgery and spectacle provision are among the most cost-effective intervention in healthcare. We invite partners to co-invest where returns are highest. First, pooled procurement and voluntary licensing to lower price of intellectual lenses, spectacles, and essential low vision devices. Second, cataract finance for the scale, mobile fundus cameras with AI capability for diabetic retinopathy detection, autofactory theater upgrade, and interpretable real-time video teleophthalmology platforms. Finally, workforce deployment for ophthalmic nurses and others middle-level ophthalmic personnel. Bangladesh always work with IAPB, International Agency for the Prevention and Blindness, and WHO, stand ready to share tools, data, and procurement specification and to learn from others, so that together we turn the case for the investment into sight restored, livelihood protected, and lives transformed. Thank you.
Joining us for our high-level remarks, Prime Minister of St Kitts and Nevis, His Excellency Mr Terence Drew.
Thank you very much, Madam Moderator. Let me first of all recognize my fellow Prime Minister, Prime Minister Browne, and leader in this initiative with others, and to recognize others at the table and all those who have joined us. But especially let me recognize Ambassador Webster, who is my neighbor just across the seas, for his strong leadership on this most important matter. Thank you, Ambassador. Let me, of course, say to Prime Minister Browne and Friends of Vision Group and the International Agency for the Prevention of Blindness for bringing us together to shine a global spotlight on something we often take for granted, our vision. Beyond being Prime Minister, I am also a medical doctor, and I can tell you with full confidence that investing in eye health is not only a matter of personal well-being, it is a national development imperative. Good vision enables children to learn, adults to work, and older persons to live independently with dignity. It touches every stage of life and every sector of society. And yet, despite the scale of the challenge, eye health continues to sit at the margins of global health investment. that must change. And gathered here in this room is the perfect grouping to act as change makers, as change at this level can and should be fueled by the offices we all hold and our own influences. In St. Kitts and Nevis, we are proud to be one of the countries championing the Vision for Everyone resolution. We've been making real on-the-ground investment in eye health, especially at our General Hospital, where we resumed eye surgeries after COVID, after upgrading our equipment stock and employing new doctors. That's helped us to start clearing a backlog of over 500 people, many dealing with cataracts and glaucoma and reversible eye ailments. And over in Nevis, the sister island, we are continuing to offer free eye care, including surgeries, which help from telemedicine and visiting specialists. It's all part of our larger effort to build a stronger public health system and make sure quality care is available to everyone, no matter where they live or their economic status. We also understand that eye health is a gateway to achieving multiple sustainable development goals, from SDG 1 on poverty to SDG 4 on education and SDG 5 on decent work and economic growth. It is cross-cutting. It is cost-effective, as was pointed out by Prime Minister Browne, and it is well overdue. So today, I join you in calling for bold, sustained investment in national eye health systems and encourage us to match the world's commitment to research with our commitment to resources. As we move forward with this mission, let us do so with political will and purpose that every citizen deserves the right to see the world clearly and live in it. I want to say to Prime Minister Browne that you can count on St. Kitts and Nevis's full participation in next year's event. Thank you very much.
If you were paying attention to the Case for Investing in Eye Health video that we showed you just a few moments ago, you would have seen Her Excellency Ms. Rabab Fatima looking 5 years younger, but she looks exactly the same. Please share your secret. Your passion for eye health, no doubt. Under Secretary General, it is good to have you. Please, the floor is yours. Your microphone will turn red and then it will be live.
Thank you very much, Femi. Yes, indeed, I look much younger. I realize that. Thank you. Thank you. Honorable Gaston Browne, Prime Minister of Antigua and Barbuda, honorable heads of state and government, honorable ministers, my dear friend, Ambassador Aubrey Webson, Excellencies, Friends of Vision. It's wonderful to be back here amongst Friends of Vision. And I thank you, Honorable Prime Minister, for your steadfast leadership and for convening this vital discussion. As a founding member of the Friends of Vision and a former co-chair with Ambassador Aubrey Webson, I'm so very pleased and privileged to remain engaged on this urgent agenda. Excellencies, we meet not only as advocates, but as stewards. And with that role comes a responsibility to place eye health firmly within global development and to ensure that no one is left behind for lack of the most basic right, the right to sight. Vision impairment affects over 2 billion people worldwide. At least 1 billion cases are preventable or untreated. Yet eye health receives less than 0.06% of global health funding, and we face a $14.3 billion funding gap. Behind these figures are stalled lives, a child who cannot learn, a farmer who cannot work, an elder losing connection with their community. 90% of those affected live in low and middle income countries. Women and vulnerable groups are disproportionately impacted. And yet, the solutions are simple and cost-effective. Every $1 invested yields $36 in benefits, among the highest returns in public health. From eyeglasses to cataract surgery, the interventions are known, the impact is transformative. General Assembly Resolution 75/310 affirms this, and it was an honor to table that resolution on behalf of the co-chairs and my good friend, Ambassador Aubrey Webson. iHealth aligns with over half the SDGs: poverty, education, gender equality, and sustainable development. And as both the Prime Ministers emphasized, it's clearly a development and economic imperative. Thank you, Prime Minister, for announcing that you'll be hosting the summit next year. And as we prepare for the 2026 Global Summit, 5 priorities must guide us. And very briefly, first, we must bridge the $14 billion funding gap. This is not a charity. It is a sound strategic investment in people, productivity, and prosperity. Second, we must fully integrate iHealth into national health and development plans. Third, we must strengthen partnerships, coordination across sectors, government, civil society, the private sector, and international organizations is key to scaling up services and reaching those most in need. Fourth, we must improve data collection and monitoring, especially for children, where rates of blindness are often underreported. Finally, we must champion vision for everyone through bold advocacy. We have a big champion in you, Prime Minister, and of course in Ambassador Webson, who keeps the issue very high on the UN's agenda, but we must keep on going. We must keep iHealth high on political agendas, mobilize new funding, and build public awareness so that vision is seen as a key driver of development. You can count on me, Prime Minister, and my office on our continued support in this regard. We support 92 of the most vulnerable countries who are on the front lines of the vision crisis and the vision agenda. UNGA resolution, Excellencies, the 75/310 gave us a clear mandate, and it remains as relevant as ever. And I would like to join our 2 Prime Ministers to say that we need to urgently act with conviction. Let us invest in vision, because when we do, we invest in equality, in opportunity, and in the promise of the 2030 agenda to leave no one behind. I thank you.
Thank you. Prime Minister Gaston Browne is hosting this event at the same time as having to make an address at the General Assembly. He's a very talented person, very talented politician, but he cannot be in 2 places at the same time. So we will allow you to leave this event briefly, talk to the General Assembly about iHealth. We will check later, and then please come back. Thank you, Prime Minister. Dr. Yusuf Tanko Sununu is the Honourable Minister of State for Humanitarian Affairs for the Federal Republic of Nigeria. Good morning, Dr. Yusuf. Please, the floor is yours.
Well, thank you very much. The Prime Ministers and President here, delegates, and most especially the Nigerian delegate ably represented here by our Minister of State for Health, Dr. Salako, and Professor Kyari, who is the head of our regulatory body, Medical and Dental Council of Nigeria, and in charge of training. I'm here to represent the President on behalf of the Vice President. I therefore bring to you the goodwill and greetings of the President of the Federal Republic of Nigeria, Bola Ahmed Tinubu, GCFR, and congratulate you on his behalf for coming together by the International Agency for Prevention of Blindness and the United Nations Friends of Vision, championed by Antigua and Barbuda. I also want to thank you for selecting Nigeria to co-host based on the giant strides she has made in the iHealth and the President's 8-point agenda, the renewed hope. To Nigeria, vision is a vital aspect of human life, and good eye health is essential for individuals to lead productive and fulfilling lives. In Nigeria, where millions of people, the statistics have put it over 0.78 Nigerians suffers from eye care, where millions of people suffers from vision impairment and blindness. Investing in eye care is not only a moral imperative, but also an economic necessity. Nigeria as a nation is committed and restate its commitment to 2021 United Nations General Assembly resolution on vision for all. This is because we know the economic benefit of good eye health are so vital and include increased productivity. Good vision enables individuals to work more efficiently and effectively, leading to increased productivity and economic growth. It also reduces the health costs. By investing in preventive eye care, we can reduce the need for costly medical intervention, saving the healthcare system resources. It can also improve the education. Good vision is essential for learning, and investing in eye care can improve educational outcomes and increase human capital. Nigeria has made significant strides in the eye care, particularly with the launch of the National Eye Health Strategic Development Plan 2024 to 2028. This plan aims to provide comprehensive eye care services to all Nigerians, focusing on promoting promotive, preventive, curative, and rehabilitative services. The key initiatives to achieving this include national eye health guidelines. We have developed guidelines for diabetic retinopathy screening and management, and also a guideline for glaucoma and a toolkit, which are the two major causes of blindness in Nigeria. The government has also made effort in integrating eye health care with primary health care. This has a dual benefit, and also it provides basic services and also promote the delivery of spectacles for those with refractive errors. Part of the strategy is also training and capacity building. We have expanded the program of training for both ophthalmologists and optometrists and other eye care professionals. Lastly, Nigeria has also worked seriously to achieve this stride by improving government budgetary allocation to health. The effort by the government have produced notable achievements, which include free care outreach programs through the participation of both government and non-governmental organizations. Free eye care center through outreaches is provided to millions of Nigerians in both curative, preventive, and treatment services. We have also increased awareness of the public towards role of proper sight and also the early detection of eye diseases. We are collaborating with international organizations and participating in this the Value for Vision conference and other conferences that come has indicated Nigerians' readiness to participate and collaborate with Nigeria. Let me also say that Nigeria has a lot of investment opportunities for eye care sector. Such include, in terms of areas of investment, can be in eye care infrastructure. Investing in eye care infrastructure such as eye clinic and hospital can improve access to eye care services, and therefore we welcome globally investors who are ready to partner with our country in promoting eye care. We're also ready to partner with the international community in training and capacity building. Nigeria is also ready to join other parts of the world in terms of eye care technology so that we can improve access to other disciplines. In conclusion, let me say that investing in Nigerian eye care sector is a sound economic decision that can have numerous benefits, including improved healthcare outcomes, increased productivity, and reduced poverty. With a growing population and increasing demand for eye care services, Nigeria eye care sector presents a compelling case for investment. Thank you.
We have heard many examples and cases for investing in eye health. But how do we turn these global commitments and this evidence into actual money, funding, programs? I'm going to bring in the CEO of the International Agency for the Prevention of Blindness, Mr. Peter Holland. He's going to talk about that evidence and global commitments, how you bring them together for a positive outcome. Peter, good morning.
Femi, thank you very much, and Excellencies, thank you so much for joining us today. I'd like to first take the opportunity to thank Ambassadors Webson, Mython and Chowdhury and all the members of the Friends of Vision for your leadership and support over the past years on eye health. We've really appreciated that support. I would like to take the opportunity also to thank Prime Minister Browne for his leadership and for his announcement earlier today of that Antigua and Barbuda will host the first ever global summit for eye health next year. We look forward to working with the government of Antigua and Barbuda to make it the watershed moment that he described. You know well the scale of the challenge of sight loss. Over 1 billion people who have sight loss because they don't have access to the eye care that they need. That's why today is so important. We now have clear evidence of both the urgency and the return of investing in eye health. Today we're launching The Value of Vision, that's this report that is on your desks, the case for investing in eye health. The report is built on solid evidence. It combines ambition with achievability to show how tackling sight loss transforms societies and economies. It sets out a bold vision, reaching the 1 billion people living with avoidable sight loss and unlocking $447 billion each year for the global economy. But it's also a roadmap which shows the practical, cost-effective steps that can deliver results straight away. The findings are striking. By prioritising just 6 accelerator interventions, the interventions that were highlighted in the video at the beginning, such as screening in the community, giving out near vision glasses on the spot, and improving cataract surgery, we can achieve rapid results within 1 to 3 years. And the report shows that investing in eye health is one of the smartest investments a country can make. In lower and middle income countries, every dollar invested can return up to $28. I want to thank our partners, especially the Saver Foundation and the Fred Hollows Foundation, and my colleagues at IAPB for shaping this important piece of work. Their evidence makes the economic case alongside the moral one and shows that restoring sight is urgent, achievable, and worth investing in. And on that note, I'm delighted to share some good news. In the last hour, Mike Bloomberg has announced a landmark commitment to our eye health. Bloomberg Philanthropies is making a $75 million investment over the next 2 years to advance eye health worldwide. A commitment of this scale will foster innovation, scale up proven interventions, and expand access to care. I know that Bloomberg Philanthropies share our conviction that preventing sight loss is one of the most powerful, untapped opportunities to improve lives, accelerate economies, and meet global development goals. So I hope we can take this momentum forward into next year's summit, because as the investment case makes clear, the evidence is strong, the solutions are ready, and the time to act is now. Thank you.
Champions of Vision, I have a challenge. I have more people to speak in the next 35 minutes than minutes in the next 35 minutes. So we are going to partner together in order to achieve this very difficult goal, which is to get all of those voices into a short period of time. So your 2 minutes that you are thinking about sharing with us, if you could abridge it so that the most powerful point is the point that you make. We erupt in applause, we thank you, we move on. That's our challenge that we're going to work on together. We're going to talk about health and education and also economy and investment in the next 34 minutes, because I've also spent a minute asking us to be brief. All right, Dr. Jarbas Barbosa, Director of the Pan-American Health Organization and WHO Regional Director for the Americas. There's a little sign icon that looks like it's a speaking face. Press that. The microphone will go green and then red.
Thank you. Thank you, Madam Moderator. Excellencies, distinguished delegates, colleagues and partners. It's an honor to address you today during this very important side event. Vision is a foundation of human development across the life course, from childhood learning to productive working years and into healthy aging. In my intervention today, I would like to highlight 3 key messages. First, while there has been some progress, it is insufficient to meet the rising global demand for vision care. Worldwide, 1.1 billion people live with visual impairment. Of these, at least 8% experience a condition that could have been prevented or remain untreated. There are also marked age and sex disparities. Globally, nearly 8% of those who are blind are aged 50 years or older, and the prevalence of blindness increases more than tenfold between the ages of 50 and 90, making eye health inseparable from the health aging agenda. The world cannot stand by as millions fall behind due to unmet vision and eye care needs. Addressing these challenges requires a coordinated and evidence-based response. The World Health Organization's SPECS 2030 initiative provides a powerful framework to expand the effective coverage of refractive services through 5 pillars: services, personnel, education, cost, and surveillance. At the Pan American Health Organization, we are translating this initiative into regional action. We are working with our member states to integrate eye health into primary healthcare systems, train frontline providers to detect and manage common eye conditions early, expand access to affordable eyeglasses and cataract surgery, build stronger data and surveillance systems so no community is overlooked. This information in turn can serve as a foundation for evidence-based decision-making. The second message I would like to highlight is that eye care must be a core part of universal health coverage, addressing both avoidable causes and chronic age-related diseases. Primary health care must be central to our approach. It is the most cost-effective, equitable, and sustainable mechanism to deliver eye care at scale. The final key message is that investing in vision is investing in sustainable development. The human and economic consequences of vision loss can be profound, from lost productivity and social participation to diminished educational opportunity for children. Every year, the world loses over $400 billion in productivity because of preventable vision loss. This is not just an economic challenge. It reflects lost opportunities, diminished potential, and avoidable hardship for millions of people. With resolution ARS 75-310, Vision for Everyone, vision care has become a global commitment. As we look ahead to the 2026 Global Summit for Eye Health, let us focus our efforts on 4 priorities. First, expanding national roadmaps tailored to the realities of each region. Second, mobilizing sustainable financing, engaging governments, development banks, civil society partners. Third, strengthen primary health care systems as the backbone of eye health services. And finally, ensure accountability through data, voluntary reviews, and aligned commitments, including those we will renew together on World Sight Day, 9 October 2025. Together with the right investment integrated to primary health care, we can prevent blindness, restore sight, and unlock human potential across the globe. Thank you.
His Excellency Narcisco Fernandez, Minister of Health for Timor-Leste.
Thank you. Due to competing agenda, His Excellency Minister was present here. Allow me to represent His Excellency Minister Dr. Elliott to read out the progress and the commitment of the country. Excellencies, distinguished delegates, ladies and gentlemen, vision is a center to the human experience, with the most of us taking the ambitious to see for the granted. Eye health is not only a national health priority for Timor-Leste, it is a cornerstone of our social and economic development. Almost 95% of visual difficulty in my country is due to cause of they are easy to treat and such as uncorrected refractive errors and cataracts. When we are gained independence in 2002, providing high quality eye care to our people was not easy. There were very few doctors and eye specialists, poor infrastructure, and limited equipment and facility for eye care. Despite these challenges, we have made important progress. We have established infrastructure for eye care service provision, and today we have 14 primary eye care vision centers, 1 in each municipality, 5 secondary eye care service centers in each region, and 1 tertiary eye care center of excellence located at the National Hospital. Trachomas has been successfully eliminated as a public health problem. Through program Integrated Saudi, we have integrated eye health into our primary health care. Investment in the cataract surgery and school-based vision strengthening are already delivering measurable results. With strong partnership, including with WHO, the 50 by 20 initiative, including a vital element of screening and management of diabetic retinopathy. Overall, we are addressing the leading cause of the poor eye health in low and middle income countries, which are refractive errors and cataracts and diabetic retinopathy. But we know most of be done. Going forward, we will. Increase domestic investment in eye health while continuing to develop partner support. Strengthening early detection of complications from diabetes and hypertension through integrated health service. Finalize our national eye care strategy 2026-2030 with a clear, measurable goals. Establish a retinal surgery department at our national hospital so that Timorese patients can access advanced care at home. Excellencies, Timor-Leste is committed to ensuring that preventable blindness has no place in our nation's future. Together, with the sustained investment and collaboration with trusted partners like WHO and others partners, we can deliver the promise of the vision for everyone. Thank you.
Thank you. The Vice Minister of Health in Greece, Her Excellency Ms. Irini Agapidaki.
Thank you. Mr. Prime Minister, Excellencies, distinguished guests, allow me to comment on the title of this event. We have the value of vision, where the meaning is twofold. Vision is actually the physical function of seeing, while, most importantly, the mental function of dream, hope, imagine, and shape the future. And I strongly believe that the mental function of vision that we can bring us together and make a difference. You know, Greece has a very, very high-level commitment to support this action and also try to further upgrade the access of eye care for people in Greece. Our Ministry of Health has integrated eye health into primary health care and public health strategies as well. We are proceeding with a new amblyopia screening program for school-aged children. And also, we raise awareness among school communities for the protection of eyes and vision. In addition, the National Child Health Guidelines include the regular vision screening at key stages development for early detection and timely referral for children in need of care. I won't take too long of your time. I just wanted to conclude that we know that still needs to be done. Greece supports the global eye health target set by the World Health Assembly, namely a 40% increase in coverage for refractive errors and 30% increase in cataract surgical by 2030. In our country, we provide free of charge surgeries for cataract due to the long wait list after COVID for people that cannot afford actually to have the choice to go more quickly to a private sector. So we have, as a Ministry of Health, contractual agreements to provide this quickly, efficient, effective a chance to people to get surgeries very quickly, not just for the public health system, but also the private sector without paying not even a cent. So we also endorse WHO SPEC's 2030 initiative, recognizing the transformative impact of simple, cost-effective interventions such as eyeglasses and cataract surgeries. Let us seize this moment to reaffirm the commitment, strengthen cooperation, and ensure that no one is left behind, not just in words, but practically. And we will stand by your side in any means, by any way we can support this very, very valuable initiative. Thank you so much.
Thank you. The next few speakers will be focusing on the importance of child eye health. May I commend you on your brevity? You're doing beautifully. I will take you for a coffee if we end at 11:30. Mr. George Laria Adjo is Director of UNICEF Programme Group. Good morning, UNICEF. Welcome.
Thank you, Femi, and I'm going to grab that coffee with you. Excellencies, my senior brother, Ambassador Webson, I'd like to thank the UN Friends of Vision Group and the International Agency for the Prevention of Blindness for co-hosting this event. For us in UNICEF, and like many of you, we see vision as fundamental to every child's right to learn, to participate, and to thrive. Yet, globally, at least 450 million children have a sight condition that needs treatment. And some 90 million children are living with some form of sight loss. We all know that children with unaddressed vision impairments have poorer education outcomes and are more likely to be excluded from schools and from society. And that is why in UNICEF we've committed to an objective of assisting these 90 million children to be screened and for them to access all the support that they need, including the provision of assistive technology. We have this commitment approved by our executive board, and we look forward to working with member states to address it. We know that nearly 50% of blindness and low vision in children can be prevented or corrected through straightforward solutions. And we believe that screening and other interventions are doable. We know that also that a multi-sectoral approach is needed. It's a question of screening, it's a question of products, but it's also a question of community engagement. So at the core of our work is to take these proven solutions to scale, working with all of you. And we strongly recognize through our presence here that eye health is central to the quality of life for every child. Their health, their education, their protection, and all matters of life. So together, we will join hands with the friends and with others to advance this agenda for all children in all parts of the world. I thank you.
Thank you. The Minister of Health for Guyana, His Excellency Dr. Frank Anthony.
Thank you very much, Madam Chair, PM Drew, Ambassador Webston, distinguished colleagues. Imagine a child in a classroom. She's a bright, eager, and full of curiosity, but every day the words on the blackboard blurs. The page of her book swims before her eyes. She squints, she struggles, and slowly she begins to withdraw. Teachers may think that she is distracted, parents may worry that she is falling behind. In reality, all she needs is a simple pair of spectacles. This is the reality that the Guyana School Vision Program is changing. And the 6 accelerators that you mentioned in the value of vision, I think all 6 of these we are covering with this program that we have in Guyana. In the last 2 years, we have been able to screen 73,000 children across Guyana in the public school system. We have tested their eyes because we have made a government voucher worth 2,000 Guyana dollars available to them and to any person below the age of 18. And for those 50 and above, they can also access this voucher. We have also, when we test their eyes, if they need spectacles, we provide a second voucher worth 15,000 Guyana dollars, where they can go to any private sector provider and use that voucher to access a spectacle. And over the last 2 years, we have been able to give 92,000 pairs of spectacles to people in Guyana who need it. For the children, we have seen from the research that we have done that there have been reading speed and accuracy would have improved at least by 20% within months. And this shows that the investment in providing a simple thing like spectacles can change the lives and outcome for children. Currently, 62% of nursery and primary school kids in Guyana have been screened, and by next year, we are hoping that we'll have 100%. The impact is not just academic. We are seeing that this screening, once children are able to improve their classroom education, that it improves their self-esteem, social connections are better, and we have fewer children who are mislabeled as slow learners. So this brings opportunity, it brings dignity, and it brings hope. And I hope that we can use this model, and we are willing to share what we have done so far in Guyana, because I think we have achieved quite a lot of good results with the children in Guyana. We are willing to share this model with those countries who might have an interest. I want to, before I end, commend Antigua for hosting next year's Global Eye Summit. And I also want to thank Bloomberg Philanthropy for the investment that they'll be making in eye health. And I'm sure all of this would help us to have a world where people who have these challenges would be able to see better. Thank you so much.
The Vice Minister of Health for India, Her Excellency Ms. Punya Salila Srivastava.
Esteemed delegates, distinguished guests, and members of the global community, it is an honor to join this high-level dialogue, and I thank the UN Friends of Vision and the International Agency for the Prevention of Blindness for convening this important event. As stated by many of my colleagues here, eye health is far more than a health sector issue. It is intrinsically linked with learning, development, productivity, progress, and equity. And yet the impact of visual impairment is especially severe in low and middle income countries where there is inadequate access to basic eye care. India has long recognized the transformative potential of eye health. The National Program for Control of Blindness and Visual Impairment, launched in 1976, has evolved into one of the largest and most comprehensive eye health programs in the world. In the past decade alone, over 55 million cataract surgeries have been performed, restoring sight, dignity, and livelihoods. Post-pandemic, in an intensified drive, 27 million cataract surgeries were done, free of cost wherever eligible, over a period of 3 years. India today accounts for nearly 1/5 of the global cataract surgeries, demonstrating both scale and commitment. India's school eye screening program has screened more than 60 million children and provided 10 million corrective spectacles free of cost. This is not just a health intervention, but a direct investment in learning outcomes and future productivity. Innovation excellencies has been central to expanding access, and under India's Ayushman Bharat digital mission, teleophthalmology has connected remote communities to specialists, while 179,000 health and wellness centers across the country are integrating primary eye care into universal health services. These models prove that eye health can be delivered at scale, even in resource-constrained settings. The results are measurable. Over the last 3 decades, India has reduced the prevalence of blindness by more than 50%, showing how sustained investment and community engagement can change the health landscape. Excellencies, a further strength of India's model lies in the depth of collaboration between public and private sectors. Leading non-governmental organizations and eye hospitals are formally engaged under the national program, working alongside government to expand coverage and provide advanced care to those who might otherwise have been left behind. Partnerships with renowned eye care institutions have brought world-class expertise and cost-effective innovations to millions of people. India's experience demonstrates that large-scale implementation of solutions is achievable, and as a result, on October 8, 2024, WHO declared India free of trachoma as public health problem, making it the third country in Southeast Asia region to reach this significant milestone. India's efforts are aligned with the global vision endorsed by this Assembly in Resolution 75 by 310, Vision for Everyone, and with the WHO eye care targets of 40% increase in the effectiveness of refractive error coverage and 30% increase in effective cataract surgical coverage by 2030. India firmly believes that investing in eye health yields some of the highest returns in public health, and India has shown that with innovation, equity, and political commitment, transformative results are possible, and we are here with all of you. Thank you.
The Permanent Secretary of Health and Childcare in Zimbabwe is His Excellency Dr. Aspect Monganidze.
Thank you, Ms. Femi Oke, Your Excellencies, Prime Ministers here present, distinguished colleagues. In Zimbabwe, children's eye health is not an abstract concept. It's a daily challenge shaping our nation's future. In many rural areas, children wake up before dawn to walk long distances to school. For those with poor vision from refractive errors, trachoma, or other preventable causes, this journey is harder and learning suffers. I met girls from various provinces who could barely see the chalkboard, but after receiving glasses through our school health program, confidence soared and most improved their grades within weeks. Our challenges go beyond refractive error. Children with albinism face severe light sensitivity without access to protective lenses, and we see too many cases of eye tumors like retinoblastoma diagnosed too late. Even with our programs, gaps remain. Insufficient coverage in remote areas, limited specialist services, and financial and resource constraints threaten equitable access to care. To address these challenges, Zimbabwe launched its National Eye Health Strategy 2021 to 2025, focusing on expanding primary eye care and school screening, improving access to affordable spectacles, strengthening specialist services, and building data and financial systems to sustain progress. We are training village health workers to screen for eye problems, expanding referral networks, and embedding eye health in our essential health benefit package. The results are promising, yet without stronger global partnerships, many children will still face preventable vision loss. I call on all international partners to join us, because every child, whether living with albinism, with eye tumors, or simply struggling to read the blackboard, deserves the chance to see and learn. Investing in a child's sight is investing in their future and in the future of Africa. I thank you.
Thank you. The Director General of the Ministry of Foreign Affairs, Romania, Her Excellency Ms. Elisabetta David.
Thank you very much. Your Excellencies, Ministers, ladies and gentlemen, friends of vision, I am honored to attend this event, highlighting the value and impact of vision for every citizen, their families, and societies as well. I would like to share some of Romania's experiences in education, as we have almost more than 3,000 children who suffer from severe sight impairment. All of them deserve a better life, a normal life, and all their families are entitled to hope that their children will be one day well integrated into the society. The fastest and more consistent way to acquire it is through a solid education, a fundamental right. Romania stands now at an important crossroads. It has the legislation, which has been updated after the pandemic, committed NGOs, specialized institutions, itinerant teachers, and access to resources like Braille and assistive technology, facilities that can underpin a modern, inclusive system for children with visual impairment. Specialized centers established in each country assess children's needs and assess children's needs and make decisions about their educational needs and support, placing the interest of the child first, with the aim at improving the functionality level and developing the child's potential. The education is unitary, but also multidimensional, meaning that it needs to determine the actual development level in order to offer a prognostic and recommendation on the further development of the child. At the same time, education is based on teamwork, with the active and responsible participation of all concerned specialists and in partnership with the child and the parents or the tutors. Pupils with special educational needs, including those with visual impairment, benefit from different forms of support during the school year, like educational vouchers, psychopedagogical interventions and materials, full social assistance consisting in food allowances or school supplies. And ladies and gentlemen, most of us spoke previously about partnership, and even in Romania as well, civil society made its voice heard in the last years. Its actions are more and more visible, with thematic parks specially developed for children with disabilities. Volunteers build connections between visually impaired and sighted communities in order to reduce stigma. NGOs arrange eye screening events in remote rural areas where many children have never been checked by ophthalmologists. And also, IT developed mobile app to connect visually impaired people with volunteer guides who can accompany them. There are things to be done. Despite progress, persistent challenges are related to uneven access and regional disparities, segregation, institutionalization risks. Mainstream teachers sometimes lack practical training and adaptive curricula for low vision or blind students, or accessible formats, and assistive devices are unevenly available and depend on local budgets or on NGO donations. But with all the gaps and inequalities, these concerted efforts lead to changes, and in the perception of the society and in the children's life. And what is nicer than the eyes of a smiling child? I thank you.
The Permanent Representative for Germany, His Excellency Mr. Rickleff Johannes Bruyten.
Thank you very much, and I will be brief. Ministers, Excellencies, Friends of Vision, it's an honor for me to be here today and address you on behalf of the German government. I would like to also thank the co-chairs, Antigua, Barbuda, Bangladesh, and Ireland, for their attention and to this important issue. And of course, I would like to thank the International Agency for the Prevention of Blindness for support and relentless efforts, and for the report that you presented, because it has the numbers that we all know. More than 2 billion people worldwide are afflicted by eye diseases or visual impairments. Eye health, of course, stretches over a vast spectrum of action fields. And not only that, it is important, I think, that you underlined in your report that improving eye health has many dimensions, and it's much more than just an individual affliction, but it is often a societal problem, because the social and economic consequences of eye diseases lead to wider injustices and sometimes exclusion from education and job markets. And the prevention and treatment of diseases is especially difficult in low and middle income countries. So I would like to just briefly underline that Germany is committed to playing an active role in this field, nationally and at international level, that our collaborative action is geared towards boosting eye health and the prevention and treatment of eye diseases in these low and middle income countries. And we do that by, for example, promoting clinic partnerships, projects to strengthen national health systems and research in the eye health sector, and by promoting diagnostics and medical care and developing, I think this is very important, and other speakers mentioned this as well, developing new forms of treatments. Telemedicine comes to mind here very much, because it can make it possible to perform eye examinations even in remote regions, and that can be an important factor for development and for preventing the exclusions that I just mentioned. So let me underline that we support the Friends of Vision's group, including in the efforts to establish a dedicated vision envoy of the Secretary General. And let me underline again that this report, I think, is very timely and very good, because it's a reminder and an inspiration for further action in the run-up to the 2026 Global Summit for Eye Health. So thank you all very much for your national and individual and personal commitment to the issue. And I would like to include Germany in this list. Thank you very much.
I have the privilege of being able to see conference room 6. Not everybody has that privilege. I see so many of you are on your devices. So we are going to do something a little differently in the last 5 minutes that will make you put your phones aside and pay attention. All right. Now I need the buy-in from Her Excellency, Miss Cynthia Samuel Olajuwon, Her Excellency Miss Sinatakala Tuithai, excuse my pronunciation, His Excellency Tomislav Dulibic, and also Dr. A.H. Monjorao Kabir. We are going to do speed round question and answer because we have lost the room, and we cannot afford to lose the room when we're talking about investing in eye health. I need everybody's attention, focus. So first of all, Her Excellency Ms. Cynthia Samuel Olajuwon, Special Representative and UN Director, ILO. We're looking at eye health in terms of decent work, economic growth. What is the most important point that you would like to leave us with?
Ms. Samuel Olajuwon expresses her apologies. She cannot come here. So my name is Carlos Carrion Crespo, and I will deliver answer the question on her behalf.
Thank you, but not a speech.
No, I've made it very short.
Yes, we don't want anyone to go back to their phones. They're going to be glued to your response. Go ahead.
At the heart of our mandate is, of course, health and safety at work. It includes eye health, and in 2022, the ILO, the constituents, decided that health and safety was going to be considered from now on a fundamental principle and right at work, which means that all governments need to comply with this mandate as part of the membership of the ILO. It doesn't matter if they ratify the conventions. There are many conventions, and in 2023, the ILO and the IAPB released the policy brief, Eye Health and the World of Work, which I invite you all to read, which finds that there's an enormous amount of people who are affected by vision impairment linked to work, and that it is it's an avoidable problem, but it affects mostly low-income countries and vulnerable communities, just like indigenous and remote communities. But we found also that investing is a very cheap way of preventing the problem. So these are very avoidable. And we aim to raise awareness on eye health and strengthen its integration into occupational safety and health programs through preventing exposure to hazards in each workplace, protecting the existing health of workers' eyes, and account for naturally occurring sight loss in risk assessments.
Carlos.
So we call for multi-stakeholder collaboration and synergies between UN agencies and different stakeholders in each country. So with that, then I give you the floor.
Thank you very much. Carlos Carrion Crespo from ILO. I'm going to go now to the Minister of International Affairs in Tonga. Good morning, Minister. So good to have you. I'm actually just going to ask you to really speak from the heart and your passion here for eye health and how we make that connection with a better economy. Thank you.
Thank you. If we look at the SDGs, almost all, if not all, of the goals there are connected with the eyesight. And healthy eyesight is a very important, it's a right of everyone to have a healthy eyesight. And those who have eye impairment, they are very much entitled for treatment and care. So in terms of development, economic development, we need it for the quality of life, our personal quality of life, quality education, quality, better productive contribution in the workplace. This part and very much part of our economic, social economic development in any country. In my small island kingdom of Tonga or everywhere else, it's very essential. And when it comes to the workplace, it's very important because human resource is a very important resource in any workplace or anywhere. So we are entitled to have healthy eyesight and treatment. So to me, it's so essential for life. It's anybody's right to have a healthy eyesight or a treatment and prevention. Thank you.
Beautiful remarks. I really appreciate you. Thank you. It is no small thing to be separated from your prepared remarks, and I do appreciate it when that happens. His Excellency Tomislav Dulibic, again, I asking you to make that connection between eye health and a better economy from the perspective of Croatia. And briefly, thank you.
Thank you, Madam. So Croatia has the legacy of Andrija Štampar, who was the founder of WHO, and we have in our heritage prevention programs. So we have two screening programs for eye vision, one for amblyopia for children, and the other one for people who work. So what is crucial is to be free of charge. These screening programs and easy to conduct. I think that's the key issue for the economy in the future. So I won't take any more time. See you next year. See you next year.
I really appreciate
on
it.
Barbuda.
Thank you.
Thank you.
Whew. Dr. A.H. Monjarul Kabir.
Thank you, moderator, and thank you, Friends of Vision IAPB. UN is very pleased to join today. Going directly to the point, I was hoping that point would be resonated with some other speakers as well. Unfortunately, it didn't happen, and it typically doesn't happen because vision impairment is both a cause and consequence of gender inequality as well. Addressing women's eye health is essential not only for equality, but also for decent jobs and economic growth. And allow me to just share a number. If you look at the more SDG 5, which is goal 5 for gender equality, women and girls make up 55% of the people with vision loss and are 8% more likely to be blind and 15% more likely to live with moderate or severe vision impairment than men. Same with women's share of informal employment worldwide is 58%, rising to over 84% in low and lower middle income countries. Vision impairment compounds this vulnerability. In order for us to address these things in 2023, together with the Australian government, Fred Hollows Foundation, UN Women released a No Women Left Behind, closing the gender and inclusion gap in eye health. So I urge all of you to look into the gap. And at the same time as my closing, I just want to urge all member states who are present here to collect sex disaggregated data, remove systemic barriers, and invest in women's eye health as part of the strategies for decent work and inclusive growth. And at the same time, we would like to support Antigua Barbuda's attempt and the decision that Honorable Prime Minister announced global summit. And we would like to join that, and we would like all member states to make this global summit a success for eye health and beyond. Thank you very much.
Thank you. Our closing remarks will be delivered by His Excellency Mr. Jorge Aranda, the Deputy Permanent Representative of Portugal.
I just have 3 sentences. The one is obviously to thank the organizers for this incredible initiative,
to reiterate our commitment to the group of Friends of Vision and its cause, and also to express our regret that our Minister for Health, who is coming late this evening, is not able to be here with us this morning. My second sentence is to state that Portugal recognizes eye health as fundamental to education, to employment, and to social participation, and this is why we have made eye health a priority, not just in national health policies, but also in our international relations policies. And this is why, and this is the third and final sentence, this is why Portugal has, since the beginning, expressed its utmost support for the organization of the Global Summit on Eye Health, and congratulates Antigua Barbuda for taking up this responsibility. And we believe that the commitment framework that should be developed in this occasion should build up and enhance the work that has been already taking place in New York and Geneva, because this will maximize buy-in from state actors and also non-state actors, including NGOs and private sector. Thank you again so much.
There is so much expertise in this room that you haven't heard from, but I will say haven't heard from yet, which is why we need a global summit on eye health in 2026. Thank you for your attention. Thank you for your time, for being part of the value of vision, the case for investing in eye health. Case closed, session closed. Good afternoon.